Now, back in 1994, they noticed that they had an unfunded liability in their pension system. And so they said, well, that's irresponsible. And so what we're going to do is we're going to pass a law to force us to become responsible. Who here has heard of the pension ramp? Anybody hear that? All right, here's the ramp, by the way. The ramp just means that every year the contribution you're required to put into the pension system increases. It ramps up. And the reason it does that is to make up for the decades and decades of underfunding. So this is the ramp they passed. And just looking at it, by the way, do you think I could design, or anyone that does tax policy could design a revenue system that grows like this over time? Think that's possible even? No, it's goofy. It's goofy. In fiscal terms, goofy. Better yet, it's dishonest. Remember, in 1994, they had a $20 billion unfunded liability across all 5 of those systems. They said that's irresponsible. The reason they got there was they weren't putting in their full pension contribution. They weren't putting in their full pension contribution because they didn't have enough revenue growth every year to maintain services and make their pension contribution. So they passed a law requiring increased contributions to the pension without passing a revenue source to fund it. They left the structural deficit fully intact and just created an increased payment obligation. Who thought that was going to work? Better yet, they knew it didn't work. So for the first 15 years of the pension ramp, by law, their required contribution was less than what they owed to the system for their current employees in each of those years. In other words, by law, they intentionally grew their unfunded liability from $20 billion to $45 billion. That was state law, sold to us as responsible. And then in 2008, the markets crashed, so it went from $45 billion to $85 billion. It was never designed to work. But now it is law, and we're looking at these huge increasing payments to make up for all these decades of underfunding. At the same time, revenue growth doesn't keep up with service cost growth. This is why the state fiscal system is so out of whack. It has nothing to do with irresponsible spending. It has a lot to do with irresponsible fiscal policy and horrible, deplorable, not workable tax policy. So in January of this year, looking at that $16 billion hole in that $24 billion budget and knowing that all this stuff was happening behind them, they decided to raise your taxes. It's the least they could do. I actually drafted the bill, so I normally don't address luncheon crowds because they're armed with food. I see that most of you have eaten it, so I could honestly say, yeah, I drafted. Now, the bill I drafted got modified enough to take all the good tax policy stuff out of it and just leave the tax increase in there barely naked. And, well, at least they generated the revenue, which they certainly needed, but they could have done some other things to really solve problems they did not do. So we still have a structural deficit. We still have an unfair tax system. We still have one that won't be stable during poor economic times. We still have all the flaws, but we at least have a little bit more revenue to cobble through. Here is the new revenue, and you're probably familiar with these things now. So they increased the personal income tax rate from 3 to 5 points, the corporate rate from 4.8% to 7%, and then they did a couple of other little modifications to get the total new revenue in the till to be about $7 billion over the course of a full fiscal year. So that's what they did. Now, why not just cut more spending? Hopefully I've made the case that that doesn't make any sense. Here you just go over the last decade, the overall cuts to the spending line. That didn't make sense. Budgeted headcount, by the way. We're the 5th largest state in the country from both a population and an economic standpoint. We rank 49th in the number of state workers per capita. And we've been decreasing the number of state workers pretty significantly. In 2008, there's been cuts, by the way, of about 7,000. So now we're in the 40s. So net, we don't have a lot of state government even left to cut from the pure state government standpoint. Those human services I talked about, state doesn't provide those. 78% of all human services are delivered by nonprofit community-based groups, or the big nonprofits like Catholic Charities, Lutheran Social Services, the Jewish Federation, etc. So we outsource a lot of state government. Now, one of the consistent arguments I've heard, and I think you've probably heard as well, is that, well, Medicaid is really a problem and it's crowding out our expenditures, particularly on education and human services. So we need to cut Medicaid and cut Medicaid eligibility and save that money and use it for these other things. That's an absolutely wrong contention to make. Let me run through the numbers and show you why. Now, when we do time sequences, we don't cherry pick. So we go back to the beginning of the prior decade or 15. We just take 10, 15-year chunks, those kinds of things. Because if you cherry pick a time period, sometimes you could come up with a result, right, that's a little different than what reality is. I cherry picked this time sequence. I want you to know that. I cherry picked it because it was the fastest and largest increase in Medicaid expenditure over any time period in the history of Illinois. This is the major increase. You'll note back in 2003, we were spending a total of $9.6 billion on Medicaid in Illinois. By 2009, it's up to $14.4 billion. That's an increase of $4.8 billion, almost $5 billion in just 6 years. That's huge. It's a huge increase in expenditure. We didn't pay for it. See this blue bar? That's the amount of state tax dollars that were used to pay for Medicaid services in Illinois. Over the same period that our expenditures increased by almost $5 billion, our taxes used to pay for that increased from 3.6 to just 4.3. That's $700 million. We got $4.8 billion in increased services paid for with an investment of $700 million. That's nothing over 6 years. How do we do it? We gamed the federal Medicaid matching system. Here's how. See this bizarre greenish color I put in the middle? That's the game. It's two things. Number one, it's something called intergovernment transfers with public hospitals, and I'll explain that in a second. And number two, it's special taxes we assess on hospitals. So starting with the intergovernment transfers, here's what we do. For 1 day, Cook County writes Illinois a big check. Cook County government gives us a check for $800 million. Here you go, Illinois. Use this for health care. We say, thank you very much. The next day, we write a check back to Cook County for $800 million. We say, Cook County, go use this for your Medicaid and health care systems. They say, thank you very much. When we write that check back to Cook County, it qualifies for federal matching funds, which are 50% rate. So that $800 million check to Cook County, once again, just their money back to them, generates $400 million in revenue from the feds to us under the matching program. We do the same thing with hospitals. We have a special hospital provider assessment. We assess a special tax to hospitals, we collect it from hospitals, and we pay it right back to the hospitals. And when we pay it right back to the hospitals, it qualifies for federal match. So here's the gaming, here's the federal match. So as you can see, over 70% of this increased expenditure on Medicaid comes from the feds. To be very clear, it's money from outside of Illinois coming into Illinois to support our healthcare industry. That would be good fiscal policy. That would be a huge positive economic multiplier. And here's the goofiness of the claims that we need to scale it back to reduce our deficit. Because of the game, for every dollar we spend in state tax revenue on Medicaid, we end up with $1 of federal match, even though our matching rate is only 50%. We're now getting $1 for $1. Which means if we cut $1 of state taxes that pay for Medicaid, we lose $1 of federal match. The brilliance of that is you've kept your deficit 100% intact, and you've lost $2 of services. Someone needs to explain to me why that's what we ought to be doing. But I thought I would take it on and in some detail because this is an issue that demagogues like to play with a lot on budget policy. I told you Human Services bears the brunt of the budget acts, and this would be the year-to-year real inflation-adjusted changes in human service funding beginning from the base year. So you could see cumulatively, even though the overall level is about $2.5 billion less, the cumulative cuts are monstrous. They're over $6-7 billion over the period of time, which means either private sector individuals making contributions to Lutheran services or Catholic charities or what have you are making up the difference, or vulnerable populations are going out without services. And it is a combination of both, of course. So, one more thing. I have heard, and I want to show our hands on this, mostly to see if you're still awake, but to see if you also heard the rhetoric. Who has heard that the recession and coming out of a recession is the absolute worst time to raise taxes? It's going to cost us jobs. And job-killing tax hike, I think, is how I've heard it explained. Okay, I got one nod and the rest of the hands went up. Okay, so most people are still awake and you're with me. That sounds rational. It also doesn't comport with the data. Why? What does state government spend on? Labor. Once again, education, health, human services, and public safety is labor cost, which means when state government cuts its spending, it's cutting spending on the salaries of low to middle income to, in some cases, upper middle income working families. And when you cut their income, you know what they do less of? Spend! They spend less. And they spend less where? In the local economy. Because low to middle to upper middle income families don't take their money and run off to Indonesia and purchase elephant hides. Okay? They stay close to home. They buy dry cleaning and groceries and car repair and something for their bratty kid who won't shut up. Okay? That's what they spend their money on. What's our economy? It's consumer spending. 70% of all economic activity is consumer spending. So a really smart economist looked at all this stuff. His name is Mark Zandi. You ever hear of Zandi? He's the head economist at Moody's, Moody's.com, the bond rating agency. And he's not a liberal economist. He's a pretty conservative economist. In fact, he was the principal economic advisor to Senator John McCain during McCain's presidential run. Okay? He said, well, based on historic actions, if state government cuts its spending to balance its budget coming out of a recession, for every dollar it cuts, you lose $1.36 in private sector economic activity. That results in job loss. So if we cut $4 billion, Illinois would lose 56,000 jobs in its private sector. This is in addition to the public sector jobs that are cut by the layoffs. Our hole was $16 billion. I only modeled it out to 9. To cut $9 billion, we'd lose 128,000 jobs. I mean, the whole Great Recession, we lost 400,000 jobs. So do you really want to lose another 56,000 by cutting spending, by being frugal? If you raise taxes the right way, which is progressively, which means upper income people pay most of the tax increase, you get no negative impacts on your economy. Why? Upper income folks have what's called a very low marginal propensity to consume. That means they don't spend much of their additional money in the economy because they're spending everything they could pretty much spend because they have so much money they don't really. So you tax them more, they don't spend less. They might save a little less, they might invest a little, but they don't spend less. Whereas low and middle income families do. They have a high marginal propensity to consume. So you raise taxes progressively and you maintain the spending, you get the flip impact. You get a positive economic multiplier of $1.36 for every dollar you maintain in your state spending. In other words, if you just, instead of cutting this money, kept that $4 billion, found a way to raise the revenue, you'd save 56,000 private sector jobs by doing that. So I know the rationale is out there that these are job-killing tax hikes, but it just doesn't fly with the data. And it's interesting to me, and I'm going to have a couple of other slides in here, how little the big, writ big, public discussion has to do with data and facts.